It was some hardware for those surgeons. But that was a sad thing. But anyway, so laminitis is... Okay, so that's large animal. Everybody good? Even you small animal people? Y'all should be able to recognize those views, and you should be able to recognize all those common conditions that I just presented to you. Know the radiographic findings and recognize. Okay, I'm going to move on to small animal. Okay, again, consult your normals. Let's talk about musculoskeletal conditions, even in large animals, because you have an opposite leg. If you're not sure about a condition, take the opposite leg. Take the opposite limb. That is very key, because most of the congenital conditions are bilateral. So don't diagnose osteochondrosis on one limb, shoulder, and not take radiographs of the other limb, because that condition is typically bilateral. I got that. Take the opposite leg for comparison. The classifications of conditions in the musculoskeletal system, they're either juvenile or acquired. Now, bone respond in two ways with injury or insult. It's either going to proliferate or it's going to lyse. That's all they know to do. Proliferate or it's going to be lysis. It depends on the location, and it depends on the age of the pet or the animal. Because they're going to look the same. If you have lysis in the mid portion of the diaphysis, it's going to be just the same as if it were at the metaphyseal region. And you call it a different condition based on the location. So here are your 5 locations. So first of all, you're going to determine if you're looking at a condition that is juvenile or acquired. Because if it's a youngster, you have a totally separate list of differentials than if it were acquired. But radiographically, they look very similar. Then after you do that, then you determine what type of lesion it is. Is it metaphyseal, or if it's diaphyseal, or if it's physeal. If it's cortical, periosteal, or it is articular. And that's your next step in terms of classification. So this is a general pattern of a long bone. Physes are open, both places. How you know it's a juvenile. This is the separate center of ossification. And so when those are displaced, and one in particular is the tibial tuberosity that is commonly diagnosed as a physeal fracture. But anytime there's a separate center of ossification, there's something attached there, some type of ligament or tendon, correct? So if it's going to be fractured, is it going to stay in this normal location? No. It's going to move because the tendon is going to move it. So when you see it in its normal location, it is not a fracture. It's more likely a physis. It just has a fusion. And we already know those parts of the bones. I just want to make clear about